Hello everyone, myself Julian K. Thomas, faculty working in Triple M College of Nursing. In this video, I am going to explain about the management of pressure injury. The objectives of this video include the group should be able to define pressure injury, list down the stages of pressure injury, and describe the management of pressure injury based on the stage. What is a pressure injury? So this pressure injury is also known as pressure ulcers. So how can we define a pressure injury? So pressure injury is defined as a localized damage to the skin or any underlying tissues, often over a bony prominence due to any pressure or pressure in combination with the shear. So whenever a part of the body or the body tissues or the bony prominence will have a pressure for a longer time, so that can leads into the pressure injury. So the causes or the risk factors can include the prolonged pressure, friction or any shear forces or any moisture. So any one component when comes in contact with the skin for a longer time, this can leads into the pressure injury. So here we need to have an early identification and management of this pressure injury in order to prevent further complications. To the stages of pressure injury. So this pressure injury can be classified it into four stages, that is stage 1, stage 2, stage 3 and stage 4. So what is a stage 1 pressure injury? In stage 1 pressure injury, there will be non-blanchable redness of the intact skin. And in stage 2, there will be partial thickness of skin loss with exposed dermis. In stage 3, there will be full thickness skin loss, possibly exposing the subcutaneous fat. And in stage 4, there will be full thickness skin and tissue loss with exposed bone, muscle or the tendon. Apart from this stage 4, we can again classify this pressure injury into unstageable pressure injury and deep tissue injury. So in unstageable, it will be covered by slough or eschar, making depth unclear. So we will be unable to identify that will come under which stages of the pressure injury. That is known as unstageable pressure injury. And the other one is deep tissue injury, otherwise it is known as DTI. So this is intact or non-intact skin with localized discoloration will be there. So that is known as a deep tissue injury. So what are the pressure ulcers treatment goals? So the goals of treating a pressure ulcer includes, the first one is we should know the underlying pathology of the pressure ulcer, and the pressure must be relieved or removed by appropriate measures to prevent further injury. So the first and important goal is that we should know what is the reason for this pressure injury and the pressure from that affected site should be relieved. The second one is nutrition is important for healing of pressure ulcer. So in order to have a proper healing of the pressure ulcer injury, provide sufficient calories, provide adequate protein for positive nitrogen balance, and provide and encourage adequate daily fluid intake for hydration, and provide adequate vitamins and minerals. And the third goal is the wound care must be optimized. We have to provide a good care to the wound so that the wound will heal as early as possible. If there is a black or yellow necrotic tissue in the wound, consider wound debridement to remove the dead tissue. If there is a high bacterial load or bioburden in the wound, consider any type of antimicrobial dressings. Cleanse the pressure ulcer and the peri-wound area at each dressing change, and also we need to use appropriate moist wound healing dressings. If there is a dry wound, we need to hydrate it. If it is a wet wound, we need to keep the dressing materials to absorb it. And if it is a shallow wound, we need to cover it. And if it is a deep wound, first we need to fill that injury and then we need to cover it. So based on the type of the pressure injury, we can use different types of dressing materials. So we can consider the wound from shallow to a deep wound, or from considering the drainage which is present from the wound from a light drainage to a heavy drainage, we can use different types of dressing materials. Maybe for a shallow wound with a heavy drainage, we can use foam dressings. If there is a shallow wound with a light drainage, we can go with hydrocolloid dressings. Or there is a deep wound with a light drainage, we can even cover with foam dressing or with the hydrocolloids. So based on the type of the wound and the type of the drainage which is present in the pressure injury, we can select the dressing materials accordingly. Now coming to the management of the pressure injury. So how to manage the pressure injury based on the stages. Already we have discussed what are the different types of stages, and based on the stages how the management can be given. So in stage 1, there will be intact skin with non-blanchable redness of a localized area. Usually it can be present over a bony prominence, and the skin will be darkly pigmented, may not have any visible blanching, and the color may vary from the surrounding area. How to manage this stage 1 pressure ulcer? So in the trunk of body, so always we have to do the preventive care to reduce further worsening of the pressure injury. So apart from that, how we can manage is that manage incontinence by keeping the area clean and dry, and use moisture barrier cream whenever necessary. Then reduce the pressure on the area by redistribution of that area. Then maintaining turning and reposition schedule. So very often or second hourly we need to reposition the patient. And in the heels, how we can prevent the stage 1 pressure ulcer is that keep the heels always floating. So we should not apply any pressure over the heel area. The heel area should be floating. So the different types of dressing materials which can be used in a first stage of pressure injury is that we can use any kind of film with prophylactic dressings like a polyurethane film dressing or silicone pad prophylactic dressing. So these are the different types of dressings which can be used in the first stage of pressure injury. Next, coming to the management of the stage 2 of pressure injury. So in stage 2, there will be partial thickness loss of dermis presenting a shallow open ulcer with a red pink wound bed without any slough. So may also present as like an intact or an open or a ruptured serum filled blister. So blisters will be commonly seen in stage 2. How to manage a stage 2 pressure injury? So in stage 2, if the wound is dry, if the wound is found to be a dry wound, then we need to clean the wound with a normal saline, then apply small amount of hydrogel, cover with a non-adherent dressing, then we need to change the dressing every day, and also we have to make sure that we will reduce the pressure in areas of pressure injury by turning and reposition schedule. And in stage 2 pressure injury, if there is a minimal drainage from the wound, how to manage the wound? So here, if there is a minimal drainage from the wound, we need to cleanse with normal saline and then apply a hydrocolloid dressing every 3 days and whenever necessary. If there is the drainage is obvious, then we need to change the dressing whenever needed. Coming to the management of pressure injury in third stage, that is stage 3 pressure injury. So in stage 3, there will be a full thickness tissue loss. Subcutaneous fat may be visible, but the bone, tendon or the muscles are not exposed. Slough may be present, but does not obscure the depth of the tissue loss, may include undermining and under tunneling will be there. So how to manage a stage 3 pressure ulcer? If the pressure injury with a minimal drainage and a clean wound bed, clean with normal saline, apply small amount of hydrogel, cover with non-adherent dressing. We need to change the dressing every day. Offload the area of injury with pressure relieving or distribution surface and the turning schedule. In stage 3 pressure injury, if there is a presence of slough with drainage, then we need to have a sharp debridement or an enzymatic debridement. So here we can use a foam or calcium alginate dressing for moderate to large drainage. If the slough is 30% or less in the wound, then a negative pressure wound therapy can be preferred. With a presence of a slough, if with a drainage, then we can have, if it is a deep wound, then calcium alginate dressings. This can be secured in place with a silicone absorbent dressing. 30% or less than, then a negative pressure therapy can be provided to remove the serous or the fluid which is present in the wound. Stage 4 pressure injury. So in stage 4 pressure injury, that is a full thickness tissue loss with exposed bone, tendon or the muscle. The slough or the scar may be present in some parts of the wound bed, often include undermining and the tunneling. In stage 4 pressure injury, if there is a minimal drainage and a clean wound bed, cleanse with normal saline. Then we need to apply the hydrogel, cover with non-adherent dressing, change the dressing every day, then reduce the pressure in areas of injury by turning and repositioning schedule. And in case of any presence or slough with drainage is present in stage 4, then sharp debridement or enzymatic debridement. Use foam or calcium alginate dressing. Slough if it is 30% or less in wound, negative pressure wound therapy can be used. Then tunneling and undermined shall be filled properly. Deep tissues injury. So that is a purple or maroon localized area of discolored intact skin or a blood-filled blister due to damage of underlying soft tissues from any pressure or shear. So this area may be preceded by tissue that is painful, firm or mushy, boggy, and warmer or cooler as compared to the adjacent tissues. So this can be considered as a suspected deep tissues injury. A suspected deep tissue injury. So we need to clean this wound with a normal saline, apply foam dressing, change the dressing every day, reduce the pressure in area of injury by turning and repositioning schedule, use a foam dressing for drainage management, and castor oil can also be applied. As we discussed earlier, apart from stage 4, there is another stage that is known as unstageable pressure injury. So this is when there is a full thickness tissue loss in which the base of the ulcer is covered by slough, yellow that is tan, gray or green or brown color, or the scar in the wound bed is present. So base of the wound cannot be visualized because of the presence of this scar. So that is known as unstageable pressure injury. We are unable to stage that will come under which pressure injury, which stage of pressure injury. So that is known as unstageable pressure injury. So in that case also we need to cleanse the wound with a normal saline, apply foam dressing, change the dressing every day, reduce the pressure in areas of injury by turning and repositioning schedule, use foam dressing by drainage management, sharp or enzymatic debridement for the management of the slough. So how can we identify an infected wound in a pressure injury? So pressure ulcers that are critically colonized or infected may show this subtle signs of infection such as delayed healing, and there will be a change in order. The secretions or the drainage which is coming out of the wound which will have a change in order. There will be increased serous exudate, absent or friable granulation tissues, and new or increased pain. So these are some of the characteristic signs which shows that a pressure injury or a pressure ulcer is getting infected. In many areas we have seen wound debridement. So what is a wound debridement? So whenever there is a slough or a scar is present over the wound area, so it is very, if a scar or slough is present, it is very difficult for the wound to get healed. So first initially we need to remove that slough and the scar from the wound bed. So that is known as wound debridement. So this wound debridement can be done in various methods, that is surgical, mechanical, enzymatic and autolytic. So what is a surgical method? That is removal of non-viable tissues by using surgical instruments. Okay, so that is known as a surgical wound debridement. In mechanical wound debridement, this is a removal of the non-viable tissues by some physical force. So that is known as the mechanical wound debridement. In enzymatic, removal of non-viable tissues by using some proteolytic substance which will be applied with the dressing. So in that way the slough and the scar can be removed. That is known as an enzymatic method. And autolytic, this is the removal of non-viable tissues by phagocytic cells and proteolytic enzyme. So what to debride? By using all these surgical, mechanical and enzymatic and autolytic, what we are going to debride? So a slough. Slough is nothing but a moist yellow, tan or gray color non-viable tissues which is present on the wound bed. That is known as a slough. And the scar also can be debrided. That is a black, dry, leathery, non-viable tissues which is present over the wound bed. So this slough and the scar can be removed by using a method that is known as the wound debridement. Is a tool which can be used to assess how far the pressure injury is getting healed. Okay, so that is known as a push tool. Even we can assess the risk for getting a pressure ulcer, that is Braden scale. So apart from the Braden scale, the another tool is known as the push tool. The push tool is used when a patient got a pressure injury and we are going to assess how far the injury has been healed. So in this push tool, we need to observe and measure the pressure ulcer. So we need to categorize the ulcer with respect to the surface area, the exudate and the type of the wound tissue. So we need to score each area. So first we need to assess the length and width of the injury in centimeters. If the size of the injury is not much, that is 0, then we'll get it as 0. If it is less than 0.3 centimeter, then 1. 0.3 to 0.6, it is 2. 0.7 to 1, then is 3. Then 1.1 to 2 will be given a score of 4, and 2.1 to 3 will be given a score of 5, and 3.1 to 4 will be given a score of 6, and 4.1 to 8 a score of 7, and 8.1 to 12 will give a score of 8, and 12.1 to 24 will give a score of 9. And if the size of the injury, that is the length into width, if it is more than 24 centimeter, then we will give us a score of 10. So this is based on the length and width of the pressure injury, that is in centimeter. Then now coming to the exudate amount. So how much exudate is coming out of the wound? If there is no exudate, we'll give a score of 0. If it is a light, 1, and if it is moderate, 2, and if it is heavy, then we'll give a score of 3. Then coming to the tissue type, what type of tissue is present? If the tissue is closed, then 0. If the epithelial tissue is found, then we can see 1. Granulation tissue present over the wound bed, then 2. If there is a slough is present, then we'll give a score of 3. And a necrotic tissue is present, then we'll give a score of 4. So all these scorings will be given in each these areas, that is length into width and exudate amount and the tissue type, and the overall total score will be calculated. So how to calculate this length into width? We need to measure the greatest length, that is head to toe, and the greatest width, that is side to side, using a centimeter ruler, and multiply these two measurements, that is length into width, to obtain an estimate of the surface area in square centimeter. So we should not guess, always we should have a ruler and we have to identify what is the length and what is the width, and length into width should be calculated. Then the exudate amount. So estimate the amount of the exudate, the drainage present after the removal of the dressings and before applying any topical agent of the ulcer. So estimate the exudates as like none, light, moderate or heavy. Then what type of tissue is present? This refers to the type of tissues that are present in the wound, whether it is a necrotic tissue or a slough or a granulation tissue or epithelial tissue. Close to means the wound is completely covered with the epithelium, new skin. Okay, epithelial tissues means for superficial ulcer, new pink or shiny tissues that grows in from the edges and as the islands of the ulcer surface. So that is known as an epithelial tissue. Granulation tissue is pink or beefy red tissues with a shiny moist granular appearance. And in slough, there will be yellow or white tissue that adheres to the ulcer bed in strings or thick clumps or in mucinous. So that is known as a slough. And necrotic, that is the eschar black brown tissues which is present over the wound bed. So whenever a patient is having a pressure injury, during the every shift, the nurse has to identify what is the length into width, the exudate amount, the tissue type, and they have to document it, and they have to write what is the push total score, and every shift they have to write it, and they have to put the date and signature. So this push tool is made by the National Pressure Ulcer Advisory Panel to identify how far the pressure injury has been healed.